Here's a detailed, comprehensive version of your topic on Adson Forceps, covering every section in depth for academic or clinical use, ideal for nursing, paramedical, or surgical instrument studies. 1. Introduction. Adson Forceps are precision surgical instruments primarily used for grasping, holding, and manipulating delicate tissues during surgical and clinical procedures. They are especially favored in plastic surgery, neurosurgery, ENT, and general surgery because of their fine, narrow tips and ergonomic design that allow precise handling of tissues without causing unnecessary trauma. Named after Dr. Alfred Washington Adson, a pioneer in neurosurgery, these forceps are known for their superior control and accuracy. They are part of nearly every basic surgical instrument set and are commonly used during suturing, wound closure, and dissection of delicate structures. 2. Definition: Adson forceps are a type of thumb forceps with fine, delicate tips, designed to hold and manipulate soft tissues gently during surgery. They may have smooth, serrated, or toothed tips, depending on the type and purpose. In simple terms, Adson forceps are small, handheld surgical tools used to pick up or hold delicate tissue or materials, such as suture dressings, during medical procedures. 3. Types of Adson forceps. Adson forceps are available in different designs to suit various surgical needs. The main types are Hesht A Adson tissue forceps with teeth. Have 1x2 teeth at the tip, 1 tooth on one side and 2 on the other. The teeth interlock when the forceps are closed, providing a firm grip. Commonly used for grasping skin or fascia during suturing. Suitable for wound closure, plastic, and orthopedic surgeries. B. Adson dressing forceps, without teeth, have smooth or serrated tips instead of teeth. Used to hold dressings, gauze, or delicate tissue without causing punctures. Ideal for applying or removing wound dressings or handling delicate structures. C. Adson brown forceps. Feature multiple fine teeth, usually 7x7 or 9x9. Provide a secure, non-slip grip on tissues. Commonly used in cosmetic, ENT, and reconstructive surgeries. D. Adson bayonet forceps. Have a bayonet-shaped handle, allowing better visibility in deep or narrow surgical fields. Often used in neurosurgery and ENT procedures. Number 4. Parts of Adson forceps. Each part of the Adson forceps contributes to its function and precision. Part description: tips, the fine, narrow end used to grasp tissues or materials, may be smooth, serrated, or toothed. Jaws, the gripping section just behind the tips, determines the type of tissue that can be handled. Hinge, pivot point, the central joint that connects the two arms and allows them to open and close smoothly. Handles, the elongated arms held between the thumb and index finger, providing control. Grip serrations, grooves or ridges on the handles to prevent slipping during use. Number 5. Uses of Adson forceps. Adson forceps have wide-ranging applications across surgical specialties. 1. Holding skin or tissue edges during suturing and wound closure. 2. Manipulating delicate tissue in plastic or vascular surgery. 3. Removing foreign bodies such as splinters or small objects. 4. Applying or removing dressings during wound care. 5. Holding grafts during reconstructive or cosmetic surgery. 6. Assisting in biopsy procedures to hold small tissue samples. 7. Dissecting small structures during microsurgery or ENT procedures. Number 6. Precautions. To ensure patient safety and instrument longevity, the following precautions must be observed. 1. Select the correct type, toothed or smooth, according to tissue delicacy. 2. Avoid excessive force to prevent crushing or tearing tissues. 3. Sterilize before and after each use to prevent cross-infection. 4. Check alignment of the tips before surgery. Misaligned tips can damage tissue. 5. Do not use for non-surgical tasks, such as holding needles or heavy instruments. 6. Handle with care. Dropping the instrument can damage the fine tips. 7. Lubricate the hinge periodically to ensure smooth movement. 7. Key features. Made of high-grade stainless steel or titanium, ensuring durability and corrosion resistance. Available in various lengths, typically 12 to 15 centimeters, for different procedures. Designed with ergonomic, anti-slip handles for superior control. Lightweight and balanced, reducing hand fatigue during long surgeries. Autoclavable, can withstand repeated sterilization. Available in toothed, serrated, or smooth tip varieties to handle different tissue types. 8 advantages. 1. Provides precise control over delicate tissues. 2. Minimizes tissue trauma during handling. 3. Offers secure grip with minimal effort. 4. Versatile, suitable for many surgical fields, ENT, plastic, orthopedic, etc. 5. Easy to clean and sterilize. 6. Long-lasting due to strong material construction. 7. Enhances surgical accuracy and efficiency. Nashnak 9. Risks and complications. Despite their usefulness, improper use can lead to complications. Tissue damage due to excessive pressure or misuse of tooth tips. Infection or cross-contamination if sterilization is inadequate. Instrument wear or malfunction if not maintained properly. Loss of grip if serrations or teeth become blunt. Accidental punctures or lacerations when used on fragile tissues. Number 10. How to use Adson Forceps. 1. Grip position. Hold the forceps like a pencil between the thumb and index finger. The middle finger may support the handle for stability. 2. Application. Gently press the handles to close the tips. Use the toothed or serrated tips to grasp tissue, sutures, or dressings as needed. 3. Tissue handling. Apply minimal pressure, just enough to hold the tissue securely. Avoid squeezing too hard to prevent tissue crushing. 4. During suturing, use the forceps to gently lift the skin or fascia while passing the suture needle. Maintain a steady grip for accuracy. 5. After use, rinse in sterile water immediately after the procedure. Clean and sterilize in an autoclave before reuse. Store in a dry, protected environment. 11. Conclusion. Adson forceps are indispensable instruments in modern surgical practice, renowned for their precision, control, and minimal tissue trauma. Whether used for suturing, dressing, or handling delicate tissue, they enhance surgical efficiency and safety. Proper selection, careful handling, and regular maintenance ensure optimal performance and longevity. Their versatility across various medical disciplines makes them a must-have instrument in every... Thank you. Have a nice day. Thank you. Have a nice day.